So, good morning, students. So, welcome to our subject Physical Education and Health, Part Pit 4, Living a Healthy Lifestyle. So, are you ready? Let's start. Our topic for this day is all about sports injury management. So, let's start. So, first, lesson objectives. What are the objectives for this topic? So, the objectives for this topic is to identify sports injuries that are life threatening. Second, to know how to manage acute and chronic injuries. So, is injuries evaluations the same as diagnosis? So, question. So, diagnosis process which must only be done by a medical doctors. You're not a doctor, so kanang mga diagnosis, those are diagnosis only diagnosed for a doctor only. So what we're going to do is to have a first aid only. Accounts all the informations needed to see a holistic pictures of the cause and severity of injury such as patient's history, comprehensive physical examinations, special tests, and diagnostic tests. So yung mga x-ray, among others. On the other hand, the goal of the injuries evaluation process, which can be done by a coach or athletic trainer. So in sports, yung mga diagnosis in sports, ang mag-evaluate niyan is some are mga coaches, trainers is to rule out the presence of the severe injury or a life-threatening conditions. Hindi pwede yung may athlete ka na may sakit ka. So, it's a big impact sa group. Or big impact yun sa isang atleta. Hindi yan pwedeng makalaro. So, how to transport the patients and appropriate. First, the first aid while transporting the patients. Of course, you're going to do the first aid. So hopefully you know already what is the first aid. What injuries can lead to death? Ano yung mga sports na pwede nyong ikamatay? Concussions or traumatic brain injury. Second, cardiac arrest. The third and yung shock. So those are the three. So classification of concussion. Category. May grade 1, grade 2, and grade 3. Description. Mild, moderate, and severe. Characteristic for mild. No loss of consciousness. Conditions normalizes in less than 15 minutes. Moderate. No loss consciousness conditions normalizes beyond 15 minutes. The last one, the severe, is loss of consciousness. So, wala talaga. So, how could a life-threatening conditions be determined? Paano mo yun ma-determine? So, sa yung life-threatened. So, unconsciousness, not breathing, yung basic lang. Kung hindi na talaga, wala na talagang malay, so yun na yun. So, hindi na naman, so, dalhin nyo agad sa ospital. Huwag nyo nang patagalin pa. Management of acute injuries. How are we going to manage the acute injuries? Yung mga injuries nyo. So, naglararo ka. Hindi lang yung paglararo, so na-injured mo sa ginagawa nyo ngayon. Depende sa inyong ano ba yung ginagawa nyo. So, na-injured ka, how are you going to manage that? If the injury is deemed non-life-threatening, what's next? The more thorough evaluations procedure or the secondary survey is to perform if the patient is stable. The goal of the secondary survey is to determine the primary injury, severity, muscles, functions, and joint stability, as well as the location and mechanism of injury or movements or force that cause the injury. It will help the coach and trainer to determine the appropriate first aid and the best way to transport the injuries athlete. So, dapat marunong kang maggawa ng first aid kung ano bang injury yan. So, hopefully, na-experience nyo na yung mga first aid na yan for your past year lesson. So, may mga topic dyan sa grade 11 at saka grade 12. So, next, questions that can help when performing secondary inspections. Number 1, how is the athlete positioned? Second, is there an obvious deformity, bleeding, skin discoloration, yung mga ora nagalagom. So, dapat makabalo mo sa inyong mga pambuhaton. Are there unusual bumps and bruises? Is the bone and joint aligned normally? Dapat chine-check yon kung may injured kayo. Does the athlete complain or more pain when more pressure is applied? So, dapat alam mo talaga yung basic. Basic talaga yung muna. So, next. Questions that can help identifying the location and mechanism of injury. What body parts of the athlete need support? So, dapat alam mo na yon. Kung dito siya may nabali o sa sa paa, sa tiil, sa kahit saan, dapat alam mo yung saan mo siya i-support. Next. What body parts can he or she not move? Dapat alam mo yon. Tinatanong mo. Did the athlete feel or hear any popping or snapping sound? O dapat. Isa din yun. Was there a contact before the athlete complained or pain? Oh. The last one is, what was the athlete doing before or she complained or pain? Okay. Question that can help when performing a gross motor check. Can the athlete move the injured limb on her or her own? Can the athlete move his or her limb throughout its entire range of motion? Can the athlete sustain the movements when the resistance is applied? Does the athlete lean when she or he walks? Does the athlete have a problem balancing her weight? So, dapat ginagawa nyo yon before you're going to do the first aid on the basic injuries. So, cervical arm sling technique. So, kindly observe the picture. So, maybe you experienced this one in the past year of your lesson. Cervical arms sling technique. So, first, second, the third, and the fourth. So, meron tayong price principle. So, may mga abbreviation, meaning for each letter. P is for protect. Protect the injured body part as aggravations will increase the inflammation. R is for rest, pahinga. Rest is recommended to give the body parts enough time to heal. Dapat rest muna. I is for ice. Ice is commonly used in injuries because it is an analgesic, or pain relieving the effect. Compression. Another effective method to reduce swelling is to compress the injured area using the elastic bandage. So, kinocompress mo yon. Ano ba yung compression? So, this topic is para siyang isang review because this topic is for senior high school, you are now in second year college. So, dapat alam mo na yon. Elevation. So, i-elevate mo yung kung saang banda ang may injured. So, swelling can be reduced by elevating the injured limb higher than the level of the heart. For example, yung paa ang may injured. So, dapat i-elevate mo yon level than heart. Because, para hindi yung dumami yung dugong lalabas. Dapat i-level up mo yun sa heart mo. Next, management of chronic injuries. Dapat marunong kang mag-manage. Hindi lang sa injuries, kundi sa life mo. Sa lahat ng gagawin mo, dapat may management ka. Okay, so next, which one should be addressed first in wound care? Bleeding or infection? Which one? The priority care for wound is to control bleeding. The second aspect of wound care is infection prevention. So, dapat bleeding muna ba? Infection. How to stop bleeding? How to stop bleeding? So, ano ba? Paano ba yun ma-stop yung bleeding? So, bleeding is the controlled by applying direct pressure over the wound. So, direct pressure, it is recommended that a clean piece of cloth and dressing is placed over the wound to minimize infection. So, dapat i-press yung injured or wound and apply the place over the wound to minimize the infection. Applying direct pressure continuously for 10 minutes is necessary before checking a blood clot formation over the wound, bracing the wounded area higher than the heart, dapat higher than the heart level para hindi dumami yung lalabas na blood. So, tourniquet are effective in controlling blood loss, but it is only performing as the last resort when bleeding is not stopped through conservative strategies. So, pag ayaw talagang tumigil, so may mga tourniquet na i-apply. How to prevent infection? Dapat alam nyo yun. Wound cleaning is important to prevent infection. So, yung isa. Dressing, wound cleaning. The process should be remove foreign contaminants and dead tissues. Dapat i-dressing nyo yung wounds. The best way to clean the wound is the running water. That is the best way. Huwag nyo i-apply yung mga alcohol because the pressure causes the dirt and the materials out from the wound. Do not use alcohol, instead use iodine to be done, which is good antiseptic, does not simulate the pain. In addition to wound cleaning and dressing may be placed in the wound to prevent contamination. So, wag yung mga alcohol para lessen yung mahapdi na part. Guidelines to provide care for heat illness. Seek shelter that is cold and away from the sun. Yes. Replenish fluids and electrolytes by making the person drink 1 cup every 30 minutes. Stretch the muscles, tendons, unit that is experiencing cramps and relieve tension. Decrease body temperature by loosening cloth, wiping the body, and cold towel for putting the ice pack over the head or neck. Guidelines in providing care for heat illness, continuation, check the body temperature and pulse rate regularly. Dapat normal. Bring to the closest medical facilities for extravenous fluid placement when temperature is about 40 degrees Celsius. Do not give anti-fever medications or caffeinated drinks for the person. So, dapat alam nyo yung ginagawa nyo. Dapat, the basic there is to know how to apply the first aid. Actually, this first aid lang eh. First aid lang dapat na ginagawa nyo. So, dapat alam mo yung first aid. Kung anong injury, anong first aid na i-apply nyo sa injury. So, that's all for this morning. So, hopefully, you view and study this video discussion.